Hi, I'm Dr. Thomas McGinn, the Executive Vice President for the Physician Enterprise. Welcome to the second 5-minute check-in. Today is Monday, November 1st, and we're going to cover an update on the vaccine situation and also some new research that's come out related to COVID. And then we're going to close with some organizational updates. There's a lot to cover, so let's get to it. So there's a lot to cover on the vaccines. As everyone now knows, all 3 vaccinations have been approved for the booster. Moderna and Pfizer, 6 months after your second shot, and it's recommended for those over the age of 65 and those having medical conditions. Also, those working in the front lines. For J&J, everyone who received the vaccine is eligible 2 months after their injection. On the mix and match studies, which means we can mix J&J with Pfizer and Pfizer with Moderna, the CDC and the FDA have approved that process. So that gives us a lot more flexibility as clinicians, depending on what's available to us and what the patient may want. The other big news is that the FDA Advisory Committee approved shots for children under the age of 12. So I assume that the CDC will do the same thing this week and approve vaccinations for those under the age of 12. That means for all of us talking to parents, we're going to have some interesting conversations with them. I think there are 3 things to keep in mind when you talk to them. Number 1, over 300,000 children have been admitted to hospitals due to COVID during this crisis. Number 2, we really don't understand the long haul syndrome that those children are potentially going to encounter. And number 3, the mental health benefits of being vaccinated. The sense that you can socialize more and more freedom will go a long way to relieve a lot of the anxiety that I think these children are suffering from. The other big news was 2 big studies that were published recently related to anticoagulation in COVID patients. The first study looked at inpatients. This was an article by Dr. Alex Baropoulos, where he randomized patients to either getting therapeutic dose anticoagulation or prophylactic dose anticoagulations. These were on inpatients with elevated D dimers. And the study demonstrated a 30% reduction in DVT and PE. And I think is pretty strong evidence that we should be anticoagulating our patients with moderate COVID as inpatients. The other study looked at outpatients, a much larger population of patients. This study was stopped short because they did not see any positive endpoints. There's a lot of criticism about this study and a lot of discussion, and I think we're going to hear more about whether we can anticoagulate our outpatients who are suffering with COVID. Last, there was a very interesting study that was published in Brazil looking at an antidepressant, Fluvoxamine. In this study, patients were randomized to the antidepressant or a placebo to see if it could reduce admission into the hospital for patients suffering with COVID. And overall, there was a 30% reduction in admissions. I think this is an interesting trial. I'm not quite sure it's ready for prime time and may have to be repeated. In organizational updates, there's congratulations due for Dr. Tiffany Annabray from Dignity Health in Stockton and Dr. Maria Hernandez from Mercy One in Des Moines. They were both selected to participate in Baylor College of Medicine's Center for Excellence in Health Equity. In this fellowship, they will be provided junior clinicians intensive mentorship and professional development to strengthen their skills in health equity and leadership. So congratulations to both of them. Also, I want to make sure people are aware that next Friday, November 12th, our leadership in pediatrics will be giving a grand rounds on the vaccine for children. So please check in for that one. So thanks for joining me in the 5-minute check-in, and I'll see you in 2 weeks.